What's the difference between physical therapy and wellness? Wellness is going to be anything that is not skilled and not medically necessary. So, wellness things would be things like personal training, massage, cupping, instrument assisted soft tissue mobilization or iStim, any of that type of stuff, maybe a stretching program, anything for general fitness, general health. You're not treating a specific impairment. Maybe they're just stiff and sore and they want you to stretch them for 20 and 30 minutes, or they just want a personal training session. Those are all cash-based services. They are not billable through insurance. Now, physical therapy, those are services that are specifically designed for a diagnosis. So you have left shoulder pain, maybe you have a rotator cuff tear, and you're treating that. All your interventions are specifically focused for treating that. You know, even if you're doing stuff with the upper back, you're working on thoracic extension and rotation so they're getting more movement overhead. Those are all skilled services directly related to that shoulder injury. And so even though there's similar things, right? You might do massage, you might do instrument assisted soft tissue work, you might do cupping, but those things would actually be skilled and targeted towards those specific impairments for that diagnosis and related to a specific function and not just directly related to general fitness. And there's a lot more different examples than just those few that I gave you. Another really important distinction would be that you need the physical therapy license in order to do that treatment. And so, that would be something like you have a knee replacement and you need to do passive range of motion and joint mobilizations very early on, but you have a big surgical wound on there. You need that specific training to be able to do those manipulations and mobilizations without damaging that surgical site. And that's where the skilled nature comes into play versus just the general fitness professional that's more on the wellness side of things. But at the end of the day, physical therapists can and should be doing both sides of the spectrum because they pair very well together. And typically your PT patients will blend into your wellness patients and then they'll transfer through and you'll just be seeing them as a personal training, maybe a just private wellness client. Hope you found that helpful. Please follow for more physical therapy related content.